All right, let's talk about calcium channel blockers, CCBs, one of the most commonly used meds for high blood pressure, chest pain, and arrhythmias. If you're a nursing or med student, you need to know these meds inside and out. Stick around because I've got an easy memory trick, dosing tips, side effects, and a huge nursing alert you can't miss. Let's get into it. What are calcium channel blockers? All right, let's start simple. What do calcium channel blockers do? They block calcium from entering the muscles of the heart and blood vessels. And when there's less calcium, the heart relaxes and blood vessels widen, lowering blood pressure. Calcium channel blockers relax the heart. So, if a patient has hypertension, angina, chest pain, or even certain arrhythmias, these meds are the go-to. Memory trick: calcium sound calm. Here's an easy way to never forget calcium channel blockers. Just remember, calcium cushions calm. Calcium channel blockers has calm the heart and blood vessels, slows heart rate, bradycardia, relaxes blood vessels, lowers BP, reduces chest pain, less oxygen demand. So whenever you think of CCBs, think relaxation and vasodilation. They calm the heart and lower the pressure. Okay, not all CCBs are the same. There are two major types, and you need to know the difference. Two types of CCBs. 1-dihydropyridines, DHPs, affect blood vessels more and in pain. Amlodipine, Norvasc, nifedipine, Procardia, felodipine. 2 non-dihydropyridines, non-DHPs, affect heart rate and rhythm. Verapamil, diltiazem. So if a patient has high blood pressure, they'll probably get a DHP like amlodipine. But if they have arrhythmias, they'll likely need a non-DHP like verapamil or diltiazem. All right, no med is perfect, so let's talk side effects. And I've got a major nursing alert coming up. Common side effects: low blood pressure, hypotension, slow heart rate, bradycardia, dizziness and flushing, blood vessels opening up, swollen ankles, edema. Biggest thing, peripheral edema. Patients on CCBs, especially DHPs like amlodipine, might complain of swollen ankles. Nursing alert: watch for edema and low BP. Who should not take calcium channel blockers? Contraindications. All right, not everyone should take CCBs. Here's who should avoid them. Contraindications: severe heart failure, can worsen symptoms, bradycardia or heart block. CCBs slow the heart too much. Hypotension: if BP is already low, we don't want to lower it more. And for patients with heart failure, we usually avoid non-DHP CCBs like verapamil and diltiazem because they can weaken the heart's pumping power. What foods and meds to avoid? Major drug interactions. Avoid these while taking calcium channel blockers. Alcohol increases hypotension risk. Grapefruit juice messes with drug metabolism. Beta blockers: double slows the heart, can be bad. Digoxin can increase toxicity risk. So if a patient is on CCBs, tell them no grapefruit juice and to be careful with alcohol. Overdose: here's the antidote. Calcium gluconate reversal agent. If a patient overdoses on calcium channel blockers and their BP crashes, we give calcium gluconate to help reverse the effects. Other emergency treatments include IV fluids, vasopressors, and even atropine if the heart rate is too low. Nursing considerations: what you need to watch for. All right, nurses, here's what we're watching out for. Nursing alerts: monitor BP and HR, watch for hypotension and bradycardia. Teach patients to get up slowly. Dizziness is real. Watch for edema, especially with amlodipine. No grapefruit juice, messes with drug levels. And one more tip: CCBs can cause constipation, especially verapamil, so encourage patients to drink water and eat fiber. Boom! You just mastered calcium channel blockers in under 10 minutes. Now you know the memory trick, types, side effects, interactions, and nursing care. If this helped, don't forget to like and subscribe for more easy med breakdowns. See you next time.